As a stroke specialist nurse, my role was set up with the purpose of starting the thrombolysis service within the 9 to 5 hours, and that was the main aim. And eventually we knew that it will go into 24/7. As nurses, we feel, oh my God, if this patient had a stroke in the 9 to 5 hours, this would have been such a different experience.
And some hospitals are very difficult to reach physically if you have to drive down there to assess a patient, where the time is the key. You have to assess them and administer the drug if they're eligible within 4 hours and 30 minutes of the onset of symptoms. So there was a need to have a technology available to us where we can see the patient and assess the patient. And that's where the Polycom video cards have been extremely helpful.
Polycom and Multisense, between the two of them, were able to set up the demonstration. Multisense also provided the training that went with the deployment of the kit.
What I can do is that while based in my own house, I can assess the patients in these 8 different centers. I could talk to the patients, I could examine them, because part of the assessment includes looking at some very subtle signs, for example in the eyes, and this is only possible if the camera on the other side is very strong in terms of that you can zoom it, that you can take the close-ups, and all these services are provided by Polycom to us.
So when we started the thrombolysis service outside the hours with the use of Polycom, I think I kind of asked a couple of patients when we were doing the service, how do you feel?
They feel that they have access to specialist services which may not be based in a local hospital, but they can still access them and they can benefit from those expertise.
It's been over a year now since telestroke was implemented, and I'm happy to say that we've thrombolysed over 220 patients. We've actually used the telecart to do the assessments, and we've done 523 assessments.
Service has grown hugely. It is used for the right reasons, and we are making real differences to the patient. And I'm glad that we have this service available, because without it, it would be very, very difficult to see how we could have provided a 24-hour cover.
At the moment, the hyperacute stroke care out of hours totally depends upon Polycam video linkage. If that linkage wasn't there, we will be going back to 10-15 years ago system where all the patients with stroke will just be treated conservatively out of hours.
Due to the telestroke solution being in place today, more patients are alive, more patients suffer less disability, and more patients are less dependent on carers and nursing homes to provide care.